Fox 5 Health News, and the FDA approves a new drug to help treat an extremely painful but common condition that can affect women throughout their childbearing years.
All right, we're talking about endometriosis. Easy for me to say. Joining us now is Dr. Jennifer Caudle, a professor at Rowan University. All right, so we've got some new treatment options potentially for this.
We do, and so endometriosis, yes, it is sort of a mouthful. It's actually a pretty painful condition for women. Endometriosis is where the lining of the uterus doesn't just stay in the uterus. That tissue grows outside of the uterus, whether it's the bladder or the colon or other places. And for women who have it, 1 in 10 women have this condition. It can cause severe pelvic pain. It can cause pain with periods, heavy periods. It can cause infertility. And it's very problematic and troublesome for a number of women. So the fact that we have this new FDA-approved medication to help treat the pain, I'm hoping will help so many people.
What about the issues associated with it? Will it help with the fertility issues and things like that as well, or is it just for the pain?
Yeah, so that's a really great question. So right now there is no treatment for the condition. We can't make endometriosis go away, but this medication hopefully will help the pain associated with it. It's a hormone-based treatment, but we also use many modalities, not just medications. So there's surgeries and other things that can happen. But yes, it does focus mainly on the pain.
Gotcha. All right, very well. All right, and we're seeing more evidence of blood sugar spikes, even in people who don't have diabetes. This is sort of a little bit interesting and not something you'd expect to see, but it's relatively common now that we're learning.
So many weird eating patterns.
No, totally.
And,
there really is. We're always talking about what we're eating, right? And are we keeping a healthy weight? And are we eating low sugar? And et cetera, et cetera. Well, this was a study that really looked at people who were not diabetic to see what their sugars were like when monitored continuously. And what the researchers found was actually in these non-diabetic people, these folks actually had spikes of blood sugar into the range of those who were actually diabetic. It does make you say, wow, and what does that mean for, say, you or I?
What's causing it?
Well, it's probably food and things like that, but the bigger question is, what does it mean for us, and will it affect us long term? Now, some caveats. This was a small study. We really can't extrapolate a lot from this. We need more studies. But it does sort of raise the question of, are there better ways to test for diabetes, because we found this with continuous monitoring? I say, look, the take-home point for many people out there is, see your doctor, just get screened for diabetes. Just start by having that conversation. That's so important.
Right. Okay. So more and more people having it. I mean, the way we eat is sort of out of
30
control.
million people. 30 million people in America have diabetes. So very
Makes
important.
sense with the food
Choices
choices out there.
I know.
We're not being
We
so
all got
great
to make
about
better
it.
choices when it comes to that. Dr. Jennifer Caudle, we appreciate it. Thank you very much.
Thank you.